Melanoma is the least common but most deadly form of skin cancer. It affects people of all ages, but for unknown reasons is especially common in women under 40. But as new research now shows, for those women, the risk of developing the disease may all be in the genes.
My father passed away from melanoma. It was a really short battle. He found it too late to be saved.
For Michelle Lynch, melanoma hit very close to home, but it was about to get closer.
This past summer, I actually was diagnosed with melanoma myself. I found something on my back that was out of the ordinary.
Michelle was lucky. Her cancer was caught early and cured. Because of her family history, she understood her risk. Now a new genetic test may help others understand theirs.
It may help us to check them at a younger age and check them more frequently and be more aggressive in removing moles to make sure that they're not melanomas.
Researchers at New York University have just identified a genetic variation that causes a nearly fourfold increase of melanoma in women under 50. The gene may be linked to the activity of the hormone estrogen, which would explain why premenopausal women are at such a high risk.
I absolutely would have been interested in getting the test done.
Nearly 1 American dies of melanoma every hour, but when it's caught early, it's 95% curable. Adults should have their skin checked every year by a dermatologist, and if you're high risk, you should be checked more often. Dermatologist Dr. Doris Day sees melanoma cases often. She says screening is straightforward.
Your skin is on the outside. We can see moles that are changing and spots that need to be biopsied and removed for early diagnosis and cure. So it's really very sad that this happens today.
For Lynch, her father's battle with the deadly disease wasn't in vain.
He saved my life by him passing away. I had that knowledge.
In addition to genes and family history, other things can increase your risk of getting melanoma. Those include having numerous or irregular moles, extensive freckling, and a history of blistering sunburns, especially in early childhood, which is why we have to be so careful with our children and make sure they wear sunscreen.
And just to review once again, because it's a question we ask all the time, you talk about irregular moles. How do we know which one is at risk of being a melanoma?
Sure. Well, in medicine, we use the ABCD rule just to know what puts you at high risk. Yep. A stands for asymmetry. The mole should not look different from one side to another. B stands for border irregularity. Try moles that have a little ruffling on the outside. Those can put you at high risk. C stands for color. A mole should not have multiple colors in it. If it has black, brown, tan, that's something you should look for. And finally, D is for diameter. If it's larger than 6 millimeters, it needs to get checked out.
Basically, if it doesn't look good or feel good, it's not good.
That's pretty much the rule.
All right, Doc, thanks.